Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. You always knew that, didn't you?
Well, good morning.
Oh, we were talking about the brain. So here's Mr. Brain, Dr. Brainy, Dr. Andy Mencia, the brain. And you brought a wonderful guest here who's got another big brain.
Yeah, the man that keep my brain together.
Dr. Jose Pimentel, a neurologist. So a neurologist. Let's define a neurologist.
Well, basically, a neurologist is a doctor that specializes in diseases that affect the brain and the spinal cord and the nerves. That basically every disease that affects this what we call the neuroaxis, we treat it. We treat the neurologist.
So when a baby is born, it seems like their brain is really little and then it keeps growing and their head gets bigger. Is that what happens?
Yeah, definitely. Definitely.
It's got that soft spot in the. Is that part of the brain?
Yeah,
what is that?
because the since the brain needs to keep growing, you need more space. So the kid. This area has to be soft so that the skull can also increase in size.
See, we never knew that, but there was always that soft spot. And I was so worried about that. You know what was going to happen with that soft spot, right? And so it needed to be able to expand.
Yeah, and later on, it will harden. So that's why we as adults doesn't have that soft spot.
Okay, so then my question is everybody's brain the same size? I don't mean what's inside, but I mean, if we took a brain out of Dr. Mencia and after you and me, are they all going to weigh the same and the same size?
Basically, on average, yeah, they can weigh almost the same. But they can fluctuate. For example, in persons that have dementia or older people that during the course of the year, the brain gets what we call atrophy, which is a shrinking of the brain, so it can weigh less as years go by and people develop these conditions with dementia.
Oh, so some people who are overweight, they maybe have a bigger brain than everybody else. Is that possible?
No. It's like the heart. The heart is the heart. That's why we say take your fist, you make a fist like that. That's the size of your heart.
And so
the heart is the heart. And like Dr. Pimentel well said, with certain diseases, like the kidneys, for example, the kidney have their size and weight. But if you have hypertension and you have a lot of little strokes going into the kidney starts shrinking. If you have a certain infection like HIV or immunological condition that produces chronic inflammation and scarring, then the kidney tend to be smaller than normal size. So when we do ultrasound of the kidney, we notice that in those persons with certain condition, their kidney will be smaller than what we expect. The brain is the same way. If the person start having mini strokes or Alzheimer dementia or Parkinson disease or other neurological condition, their brain will start shrinking. When we look at the MRI and CAT scan of the brain.
That's another way to discover things. So Dr. Pimentel, when you were thinking about what you wanted to be in the medical field, what made you want to be a neurologist?
Oh.
See, he has all these notes. I never ignore the notes. I just want to know who he is, right?
Yeah.
Sorry.
We want to know you first.
Right.
Whoa.
Why did you become, you could have been, so many things.
Yeah, because it was the part of the medicine with most mysterious.
Right.
Because there's a lot to learn about the brain still. We still need to learn a lot. We need to do a lot of research in the area of the brain. Many other conditions has been explored thoroughly, but the brain needs you're going to see in a couple of 10 to 20 years, you're going to see an expansion in the field of neurology because of the new treatments and that will be available to treat the neurological conditions. So that's basically why
And so when
I
you were
decided.
a kid, you had that idea, right?
No, not necessarily.
But I'll tell you a funny thing, because we all see pictures of a brain, but I went to a symposium, and this is head of a neurological division of some big institution, and he said, now, if anybody's queasy, you can leave, but I'm going to show you a brain. He pulls this brain out. You know, it was a real brain, without the person, of course. And, you know, it was very interesting. Most of us have never seen a brain. So when did you get your first brain to look at?
The first brain?
In medical school?
Yeah, first year of medical school with opening of the cadaver.
So
that was
interesting,
the
wasn't
first
it?
exposition, the first year of medical school.
And how about you, Dr. Mencia, the same
Also,
thing? Everybody
yeah.
gets to see
Yeah.
the brain. Did it excite you? I mean, did you
Yeah.
wonder what all those little things
Yeah,
were?
you know, yes. And I remember that the Department of Neurosurgeon say, oh, you know, you might want to be a neurosurgeon, you know, because, you know, it's like Dr. Pimentel, you get, you know, you want to find out more, like, oh my God, there's so much stuff to learn about the brain, the way it works, how things crosses over. Say, like, how can this be so well organized? You know, it make you think they have to be a superpower out there for us to have all the information. And like he said, there's so little that we know in science. And sometimes, you know, as a doctor, it breaks your heart when I have one of my patients that her daughter is now a teenager. She's been my patient for a few years now. Her daughter is now a teenager. And I always ask about her daughter because she suffers from epilepsy. So she has seizures and very uncontrollable. They have done brain surgery. They have done so many things trying to help her control the seizure. And the poor girl suffers so much and it's taking multiple medication. So there's still a lot to learn. We have so much stuff to learn about the brain.
Epilepsy. So that's part of neurology,
Yeah, that's
isn't
part
it?
of
That's the same
neurology.
thing.
Yeah. Mm-hmm.
But you were going to say something about the brain with all the, you know, when you think of it, it's, and we always refer now, we didn't have computers 50 years ago, but people call the brain like a computer.
It's kind of like a computer. Yeah. It's yeah. Mm-hmm.
Because it has I mean, it has to
Because-
be able to
yeah.
know everything. I mean, it has to,
Influence the entire body.
yeah, I mean, when you think of it, but the memory, let's just say, okay, it influences all our body parts, but the memory that you have to be able to go back to something that happened 50 years, 80 years ago, or just happened. I mean, it's really, it really is a mystery. I'm glad you brought that up because I've always thought of the brain as a mystery. There's nothing else as mysterious as a brain in your body, is there?
I don't
Yeah,
think so. I
no,
think it's the most mysterious organ that we have. You know, imagine then you have, I mean, we can just talk about the what we don't know about the brain and hold 2 or 3 hour show just about the brain. You have the conscious and the subconscious. So when you consciously doing something, you're writing a letter, you're consciously doing something. If you are right-handed, you take the pen with your right hand and consciously you are writing. Your left hand unconsciously is holding the paper. Your leg might unconsciously be doing something. So a lot of things that we do, we have the conscious and the unconscious working in completely different direction. But your body get to move and do things. So
Oh, wait a
it's-
minute. We're sitting here talking, and we're thinking, talking, and we're doing other things,
we're
right?
doing other things.
And
Right.
so the
Exactly.
brain is responsible for my hands moving and
Right,
Yes.
exactly.
as well
Exactly.
as my talking. So we're doing multiple things at one time,
Multiple
right?
things.
Right.
So now let's jump into Alzheimer's and dementia and what your field is, because this is your specialty.
Yeah. Basically, I have
And
worked
Parkinson.
many years with the geriatric neurology field, and many of my consults have to do with Parkinson's disease and tremor disorders. So tremor is a very common condition that develop the elderly population. Yeah, and but most of the time, The tremor doesn't have to be Parkinson's disease, and that's why you need to visit either your primary physician or your neurologist to really evaluate you if you have Parkinson's disease or not.
But what else could, if it's not Parkinson's with a tremor, what would it be?
For example, many times that a patient comes with a tremor, you first need to look at the medicines of the patient. There are certain types of medicines, for example, antidepressants, antipsychotic medicines, anti-epileptic medicines, even medicines for the COPD or asthma can cause tremors. And sometimes those medicines are the problem, and not that the patient has a neurological condition. Also, you need to examine the thyroid, because problems with the thyroid can cause tremors. And so those things are first addressed by the primary physician of the patient, and many of the time they can change the medicines or work them out.
What you may not know about Dr. Mencia is that along with being a geriatric physician, he's a very good diagnostician. And that's what you're saying. So someone comes in there, and instead of saying right away this or that, he diagnoses what they may have. So maybe someone's told them that they have epilepsy or they have this or that, but he may see very quickly, just he has this inner something, it's his brain, that says, no, I don't think that's true. Let's really look at this. And then, of course, they do tests afterwards. But that's what I said about you.
And that's like Dr. Pimentel was said again. When the patient come in to me, and the first thing that they come is they say, well, I have this tremor, or my wife or my husband has this tremor, and we are afraid that he or she might have Parkinson. And I say, there's a familiar tremor, there's a benign tremor out there, so we go through the medication. So when they're going to go and see Dr. Pimentel for the consultation, I have already ordered the blood test that I know he wants to see, and make sure the medication that the patient is taking, we have it in order, and that he's not over-medicating, overdoing any of the medication. So by the time they go to Dr. Pimentel, sometimes even if I think he's going to want an MRI, I might order the MRI ahead of time so that he has that done.
So I'm going to ask the big question.
And the beauty is,
question
you know what makes him special?
What?
That you don't find many neurologists that will see you on Saturday, that have Saturday hours.
You don't see a lot of neurologists who'll see you for weeks and weeks. Don't forget Saturday, right? That's wonderful because he's associated with you. So my big question is this. Why can't we figure out what Alzheimer's is, and so we can change the world? What is going on, Dr. Pimentel?
It's difficult to do experiments in people that are alive. So much of our knowledge is based on biopsy of brains and doing with people that already died, and studies with animals. It's very hard to get data from biopsy and really figure out what's going on. I think that on the next years, there will be a boom in the neuroimaging techniques. For example, better MRIs and better neuroimagings, so that we can take a look at in real time what is happening and do experiments with people's brain in real time to see what's going on and have a better picture of the problem.
Yeah. So, what is your opinion of this, Dr. Mencia? You've seen this a long time. Why is it that we're not progressing? Well, yes, we have different kind of medication, but once someone has Alzheimer's, it's pretty hard.
It is hard, and unfortunately, our society is spending more money on medication than on the etiology, the cause of the condition, who's at risk, who's not at risk. Now we're talking about MCI, mild cognitive impairment, and 50% of those patients with MCI will develop Alzheimer's disease. So now we're working more into the preventive part. before the person get into the dementia,
And is there a
full-blown
prevent- is
dementia. Well, yes, in my practice, for example, because I practice internal medicine for the young adult and the baby boomers, and geriatric medicine for the elderly. So everybody that walks through my office will get a well-cup with vitamin B12, folic acid, full thyroid panel. And if I detect somebody in their 40 with vitamin deficiency, I start treatment early because we have seen so many patients in their late 60, early 70 with vitamin B12 deficiency. They probably were carrying this for, who knows, 15, 20 years. And then they develop, MCI or Alzheimer dementia.
Well, when you prescribed that I took vitamin D, and I still take it, I didn't get vitamin B12.
Because you didn't
Maybe
need it.
need it.
You didn't need it
What-
if your body is...
Well, what if I took it? Would it hurt if I took
No,
it?
it doesn't
No,
hurt.
it doesn't
No,
hurt.
it doesn't hurt.
Ring me up to vitamin B12.
Yeah, be complex.
Become
Yeah, be complex. But
So
going
that's
back,
called prevention.
going back to the tremor, that's very interesting with the tremor and Parkinson disease. What is the cause of in the tremor if all medication are put aside and the thyroid being normal? Do we know what's causing this, and how do you differentiate the etiology here versus Parkinson's disease?
Well, basically, the first thing that we need to ask is the characteristic of the tremor. For example, if the tremor occurs at rest, when the patient is supporting the hands against the knees or any other surface, or if the tremor is when the patient is doing voluntary activities,
Like grabbing a cup of
grabbing a
coffee.
cup of coffee, or holding the cell phone, or
they
writing.
would shake while they're doing
Exactly, because what happens is that when the tremor occurs when you're doing a voluntary activity, such as grabbing a cup of coffee, most of the time it is not Parkinson's disease. It is a benign condition called essential tremor. And this is a benign condition that the medicines that we use work pretty well, and it will not progress into any Parkinson's disease or any dementia patient. And so most of the time is the benign condition called essential tremor. What characterizes the tremor of Parkinson's disease is a resting tremor, especially in one hand or one leg.
So you're
and the
sitting
tremor,
there, you mean doing nothing.
nothing.
And your hand is...
Yeah, exactly. And the hands start shaking. It can look like you're rolling a pill with your first two fingers. Like that's why they call it a pill rolling tremor, because it looks like you're rolling a pill. And curiously, the tremor in Parkinson's disease, the tremor is less disabling than the tremor in the benign condition, essential tremor, because the tremor in Parkinson's disease disappears when you do a voluntary activity. So the patient while grabbing the cup of coffee, while writing, the tremor tends to disappear. So the tremor per se is usually less disabling than the other one.
That's very well explained. So in other words, when sitting there quietly and it's a tremor, it's probably towards Parkinson. If they're picking up something and they're tremor, so see that?
That's a benign.
Yeah, that's really interesting. All right, so now let's say you find someone like that.
Yeah.
How can you treat them?
Yeah, well, basically, we have a lot of treatments right now for Parkinson's disease. The whole idea of treating Parkinson's disease is to give medicines that increases chemical in the brain called dopamine. Because the main problem with Parkinson is that the brain cells that produce dopamine, they are dying. When you get the diagnosis of Parkinson's disease, the scientists have suspected that more than 60% of your brain cells that produces dopamine have already died. And this is the big problem. So we need to give the patient dopamine. So all the treatments that you're going to see right now for the treatment of Parkinson's disease has to do with increasing the levels of dopamine in the brain. For example, you can use medicine that the most commonly used and the most effective is called carbidopa-levodopa, which is a combination of two medicines of levodopa and carbidopa. The levodopa is the medicine that converts to dopamine in the brain and do the action. So the question is, why do you need to give carbidopa in addition? Well, because the levodopa, when you take the levodopa and the levodopa dissolves in the blood, the levodopa quickly transforms into dopamine in the blood before reaching the brain. So you need to trick the medicine and you need to give the carbidopa, which inhibits the conversion of the levodopa to dopamine in the blood. And then when the levodopa crosses the blood-brain barrier and goes to the brain, it converts to dopamine and then exert the action in the brain.
So now I know why you have Dr. Pimentel there with you.
Yes.
He is one smart cookie, isn't he? So when you were talking that about, but wait, so this, let's say someone's on dopamine. What else would it do to other things? Sometimes a medication causes other things. Is it going to cause more sex? What's it going to cause?
Less tremor, more sex.
Maybe tremor's good with sex. I don't know. Sorry. Got to be something good from having Parkinson's, right?
Yeah, one of the things that we see is the blood pressure. Mm-hmm. So if the patient is on blood pressure medication, as Dr. Pimentel is treating the Parkinson, I monitor the blood pressure and I start backing away from blood pressure medication.
Exactly.
Because the patient can fall, and it's not because of the Parkinson, but because of the fact that the regimen that we're giving for the Parkinson disease might be dropping the blood pressure. So we monitor the blood pressure very closely. And the moment we make the diagnosis, and Dr. Pimentel can talk about the importance of exercise in Parkinson's disease.
Really?
It's a lifesaver. It's quality of life.
Yes, yes, definitely.
And a lot of time I tell my patient when they have early Parkinson, I'm going to send you to physical therapy. I want the therapist to come home. I want you to go to outpatient therapy.
Really?
And they say, no, I'm still okay. I can walk with my cane. And they don't understand. What do you elaborate over the importance of exercise?
Yeah, definitely. As a matter of fact, I have an example that there's a NBA player called Brian Grant. I think he's a retired NBA player who developed the Parkinson's disease early on at 36 years old after he retired from the basketball. And the important thing of his situation is that he started a foundation for people with that develop early onset Parkinson's disease, and he started to notice something that he noticed that his condition did not advance so much when he compared himself with others, and he asked himself, why is this happening? And the only difference that he had was that he was continuing doing the same regime of exercise he was doing in the past. And he wasn't deteriorating so much. And now there's evidence that people with Parkinson's disease that do exercises, the disease slows down. Yes, and what scientists suggest is that exercise made the cells exercise made that the cells that responds to dopamine, they respond better. Wow. When you exercise. That's what they are thinking right now. So yeah, it is very important, and the exercise has been proven that it slows down the disease, and it can also make you more functional, because another characteristic of Parkinson's disease, I mean the hallmark of Parkinson's disease is not tremor. The hallmark of Parkinson's disease is what we call bradykinesia. And what is bradykinesia? Well, it's a generalized slowness in the movement of your body. That's the hallmark of Parkinson's disease. You see that the patients cannot move their arms with the same swing as a normal people. That they have problem buttoning shirts, tying the shoelaces. They have problems with the rapidity. And they also have rigidity in their extremities. So by doing exercise, you can improve those symptoms, and definitely you can get better, and you can prevent many of the complications associated with those symptoms. For example, you can prevent falls. You can prevent several injuries in your body by doing the exercise. Mm-hmm.
Well, one thing we haven't done is we haven't given away. You have to definitely call for an appointment. Or will you be there Saturday this morning?
He's there today.
Oh, he looks good too.
Today.
He's dressed just like you, all beautiful. It looks like he's going to a big party. He's going to the party at AGI Medical and Dental Centers. Let me give you the phone number. If you could make the appointment, it'd be great. If not, just go there. 954-489-1345. That's the one in Fort Lauderdale, which is at 1608 East Commercial Boulevard. Get off I-95 and just go head east. It's very, very close to Holy Cross Hospital. So this is, I just wanted to say, Dr. Jose Pimentel, Pimentel. Mm-hmm. And, of course, Dr. Mencia is always there. And he'll be there today, too, to take care of.
We both will be seeing patients. The dental department will be also open today seeing patients.
Great. Well, listen, they have so many things going there. So make sure that you do. They do have home visit services available.
If you have a problem with, not only with the tremor, like Dr. Pimentel said, you or your loved one has, what we call the flat affect, that, the people smile, and it looked like they gave you Botox. Your face doesn't move, it's called the flat affect. If you have problem walking, sometimes you get stuck in when you're trying to walk. It's like a magnet is holding you down. The more advanced the Parkinson is, like Dr. Pimentel said, what that's telling us as clinician, as diagnostician, is that the level of cells that have died already in the brain. So the early we detect, the better we can help you maintain a good quality of life.
And exercise.
And exercise and stone water to keep you.
Stonewater spa, right. We have to make sure people go over there. And they're open today on Saturday, aren't they?
They're open today.
Okay, so let me give you a number there for Stonewater Med Spa, 954-561-8799. 561-8799. That's 954 first. That's not 561 is not the...
And they can text the word stone, and then they'll send you back all the specials going on through your phone.
Ooh, okay. Text stone. Thank you, Dr. Pimentel.
Thank you very much for having me today. And
I learned a lot. It was wonderful.
It's been a great experience.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.